it going, everyone? I'm Leslie the LMT, back again with another massage therapy inspired self-care routine. This time for the lower body, especially the hips. So today, what you'll need, a length of something. It should be pretty lengthy because we're actually going to hook it over the foot. I've got my trusty scarf here. You'll need either a stack of books. I have a yoga block. Anything that's going to elevate you a little bit and that you can stand on safely should work. I also have very hard floors, so I have laid down some yoga mats. If you have carpet, you should be fine, but if you need to cushion yourself from the floor, we will be doing some of our techniques on the floor. So as always, adjust any of the moves to fit your level. You know your own body and your comfort zone. So thank you so much, and from my heart to yours, please enjoy this hip opening practice. Start off by gently swinging the arms side to side, rotating the torso. Really feel this in the front and sides of the hips. Alternate drawing semicircles in the air with the knees. You can exaggerate this motion, but be mindful of your balance. We're going to do a technique for the psoas, or front hip flexor, next. Being a deep core stabilizer, there's always some tension on the psoas when standing on 2 feet. So here's where you'll need a block or something to step onto to get slightly off the ground. Place it near a wall to hold for balance. Let's stand elevated on one leg to let the psoas of the other leg lengthen. Try to keep your pelvis tucked slightly and comfortably and your hips level. Explore small movements with that leg to increase the effects. Without dropping one side of your hip below the other, with your mind's eye, put your awareness in the hip crease of the floating leg and relax and dissolve any tension there. Make a mental note of what foot is on the block so you can switch legs for the next round. Carefully step down, and keeping that gentle pelvic tuck, stand and notice any difference side to side, especially spaciousness in the side we just lengthened. Coming back to your step, now repeat this technique, switching the standing leg. People today, at least in my culture, do a lot of sitting. When seated, our psoas is contracted and shortened, so it would be difficult to find someone without a tight psoas these days. It's also a tough muscle to stretch per se, so gently tucking the tailbone works against the shortened psoas that wants to just sway the pelvis back like you're sticking your booty out. We're also taking tension off the non-standing leg psoas to experience a rare lengthening of this muscle to build awareness around what a relaxed front hip flexor feels like. Step down carefully and notice the difference in the front of the hips. Starting with the top of the right thigh, use tapotement or striking the tissues to loosen the muscle. I'm using karate chops, but you could use fists as well. Make sure to really hit on any tender spots. Shake out your hands and move to the inner thigh. You may need to ease up here as compared to the top of the thigh. Shake out your hands, and now move on to the outer side of your legs. You can try fists or chops, whatever feels best. Shake out your hands and take a quick moment to stretch the wrist and the forearm. Let's learn a technique called friction to use down the center of the thigh. Position the tip of your elbow as close to the hip crease as you comfortably can. Use the opposite hand to stabilize the point of the elbow on your thigh. You're going to simply lean into that spot rather than push with the elbow to keep your joints safe. This will probably be tender on the thigh, so don't lean in too hard. You want to keep the sensation in the thigh at or below an 8 out of 10 on the pain scale. Gently hug the working arm shoulder down and back, pinning it in its socket and stack it over the elbow. We never want to compromise one body part to work another. You're just slowly working from the hip crease to above the knee, leaning into a spot for several seconds, and you can even add small circular motions with the elbow if that feels good to you. You can stop a few inches before the knee and then start again back at the hip crease, working slowly along the thigh. Be aware of and release any tension building in your body as you work. Take a moment to relax both shoulders down and back, release and relax the lower back and hips, let the hand of the working arm just hang slack, let go of any clenching in the jaw, and so on. Just check in. Start your third and final pass down the center of the thigh with friction. If you're doing the small circular movements but you find you keep slipping off the spot, even with that opposite hand helping to stabilize, I'd rather you focus on hooking into a spot and progressively leaning in more. Really focus on the release. Knots and fascial adhesions love to kick us off of them, so you may need to remain static to be most effective, depending on your body and the spot in question. Shake out the arms. Now cross your ankle over the opposite knee to do the same technique on the inner thigh. You'll probably use less pressure in this area as it tends to be more tender than the top of the thigh. Begin another slow pass, starting at the hip crease and stopping just before the knee. Remember, you are just using your body weight to sink in with that elbow, not using muscular energy to push the elbow. Friction down the inner thigh one more time. Shake out the legs, shake out the arms, and do a quick chest stretch to finish up friction on this leg. Now same sequence, opposite leg, starting with tapotment on the top of the thigh. Shake out your arms, now cross the ankle over the knee to touch on your inner thigh. Shake out the arms and move to the outer thigh. Shake it out once more and give the wrist and arm a good stretch. Set up for friction on the top of this leg by stabilizing the elbow point with the opposite hand. Relax your body, hug the shoulders down and back, and lean into that elbow until you're at or below an 8 out of 10 on the sensation scale. Work again from hip crease to just before the knee. You can simply lean in or add small circular motions if you can do so without being kicked off the spot you're working on. One more pass down the thigh. Shake that out and cross the ankle over the knee to work the inner thigh now. Stop just short of the knee joint and move back to the hip crease for another pass. One more time, working the inner thigh, keeping the body relaxed, stacking the shoulder over the elbow, keeping it hugged down and back and protected. Release it and give yourself a nice stretch through the chest. Let's learn to use the thumb as a tool to break up fascial adhesions. Imagine almost like you're holding a box cutter. The thumb is completely straight and hugged against the fist to protect it from injury. Now press your imaginary box cutter against the skin and push it along like you're cutting a straight line. It's important to fully support the straight thumb, and only the very tip is used to carve. If you have long fingernails, you can use your knuckle ridge. Just go very gently because it is more difficult to protect the joints in that position. Let's use this thumb tool to work adhesions along the upper curve of the pelvic bone, namely the tensor fasciae lata, the glute medius, and the upper glute maximus. We'll also work the diagonal line from the mid-sacrum to the top of the pelvic bone, where the chronically tight piriformis muscle lies. Bring your imaginary box cutter to the area, sink in, and draw lines down towards the floor. Protect the thumb, and if it feels like you get snagged, keep your steady downward pressure until the adhesion breaks up and you're able to move past it. You can even chisel back and forth with your thumb tool if you find a really stuck spot. Remember to keep your sensation level at or below an 8 out of 10. Notice how my shoulder is hugged down and back. When we're working one area of the body, it shouldn't require sacrificing or tensing up another area. Release and shake it out. After using the thumb tool, I like to pinch that thumb with the opposite hand and give it a little traction. Switch sides, always protecting your thumb joint. If any of these moves do not feel right in your body, do not do them. You can always use the knuckle ridge here, but just remember to use lighter pressure. We're working the upper crest of the pelvic bone, then in that diagonal towards the middle of the sacrum, which is that flat, upside down triangle bone in the lower back right above the tailbone. It's a trick that the mind plays on us, telling us we have to tense up in order to complete these motions, but it's not true. Just relax your hips and your lower back, your legs, your feet. Relax your arms, your shoulders, your hands. Relax your jaw. Just check in. Shake it out and go ahead and give some gentle traction to the thumb joint if that feels right. Now we're going to cradle our shin and rock in the hip socket to loosen the tissues there. If you can't reach, just cross your ankle over the knee and rock from there. Otherwise, gently hug the shin and rock it back and forth for a minute here. You can close your eyes and really feel into the gentle massage this creates in the sits bone. Soften the tissues of the lower back, especially around the sacrum. Release and soften the tissues at the outer hips. Gently let go and shake everything out. Switch to the other side, gently cradling the shin and rocking back and forth. Of course, modify if needed. Notice here that I released my leg into my hands instead of clasping the arms around the shin because that just felt better in my body. So that's a way that you can loosen the pose if it doesn't feel like a comfortable reach. If you find, like me, one side of your body is quite different from the other, that's very common, so don't sweat it at all. Relax your low back and hips. Relax your shoulders if they're creeping up towards your head. Just let go of any tension. Release, shake it out, do a little shimmy. Now we're going to rake to either side of the spine on the lower back. So interlace your fingers to create two mountains with the first knuckle ridges as the peaks. You'll actually interlace like that behind the back. Make sure your mountain ridges are poking towards your back and then just rub vigorously up and down on either side of the spine. Shake it out, twist gently from side to side, and release that work. We're heading to the floor, so grab cushioning if you need it. Going back to that thumb tool, this time from the top of the hip all along the IT band. I like to have the legs exposed here because I find the friction on fabric bothersome, but you don't need any extra lotion or massage oil. I just lotioned my legs like I normally would on any given day. Protect the thumb and work your imaginary box cutter down the side of the leg. When you get to the side of the knee, do a couple extra passes, really focusing on the attachment of the IT band. Back up to the hip. Remember to stay on any snags until they dissolve. And this can be quite tender, so remember that 8 out of 10 on the sensation scale. Shake it out, traction the thumb, and start again at the top of the hip. Breaking up fascial adhesions like this can cause little bruises, almost like Dalmatian spots. They're generally light and they're nothing to worry about. You might even notice mine from the practice takes from yesterday. Shake out the legs before switching sides. Always remember to protect that thumb joint when using your thumb tool. Do some extra passes at the knee when you get there. Start again at the top of the hip. Reminder to relax and release any tension you don't need, which is basically any tension you're experiencing. Carving one more time down the IT band. Shake out the arms and hands, the legs and feet, and traction those thumbs. We're done with carving. Now get your belt or scarf, hook it around one foot, and gently lie on your back. The leg should be at 90 degrees, and the other leg can either be bent at the knee with the foot flat on the floor or resting straight down if that's comfortable. Relax your head down and use the strap to bring the flexed foot towards the head just to the point of a comfortable stretch. The stretching leg should be straight, but the knee is not locked. And in fact, if you need to increase the bend in the knee to make this more comfortable in your body, go ahead. Let go of any unnecessary tension and settle in. Use the strap to slowly guide the foot out to the side, stopping at a comfortable stretch. See if you can position yourself so that the only tension in the body is in the hands just easily holding onto the strap here. As we stretch, if you find that you can go further, go ahead, just as long as you're not pushing past your comfort zone. Mindfully and slowly, use the strap to guide the straight leg up and over the body now to the other side. Stop wherever is comfortable for you, then start to settle in and consciously relax the body. Slowly release this, letting go of the strap and hugging your knees towards your chest. Move both knees in a gentle circle, massaging the lower back. Grab your strap, hook it around your other foot now, and start this sequence again, starting with the legs straight up and the foot moving towards the head to wherever it's comfortable, knee slightly bent. In this position, we're stretching the hips, but we're also hitting the hamstrings, which are a major contributing factor to lower back pain if they are tight. And sitting all day tends to make the hamstrings quite tight. Relax and move deeper into the stretch if you can. Guide the leg to the outside of the body, stopping at a comfortable stretch. Stretching like this after we've worked to mechanically release inhibiting factors in the muscles with our massage techniques really cements the effects of our practice by re-educating the entire length of the muscle. Last side for this leg, bring it up and over the body, targeting the IT band and the outer hip. Let go of the strap, release this work, and bring your feet flat on the floor. You can bend your knees side to side in a windshield wiper motion for another sweet release in the lower back. You can either roll up to seated or come to your side and use your hands to push you into a seated position. Come onto all fours and slowly alternate between arching the back and rounding the back to stretch the entire back, the hips, and the chest. Begin exploring some undulating motions with the hips, bringing them back towards the feet, rocking into and leaning into one side and then the other, back to all fours, swaying and circling the hips and shoulders. The fascia responds beautifully when we move in novel ways. Now come into a simple cross-legged position, and you can stay here or bring one ankle on top of the opposite knee for a deeper hip stretch. Notice my feet stay flexed and active in this position to protect the knees. Fold forward as far as you comfortably can and try to keep length in the lower spine. Slowly come up, shake the legs out in front of you, and either switch the crossing of the legs or which leg is on top, depending on which stretch is best for your body. Slowly come back up and give yourself a quick twist right and left. Come into all fours and step one foot forward towards the hands for a lunge. Stack the knee over the ankle and get comfortable in this position. We're going to be here for 1 minute, so you can be on the fists rather than the hands. You might need to back out a little bit. You can point the back toes or keep them tucked under, whatever works best for your body. Relax the tissues of the lower back. Please make any adjustments you need. You can even back out for a brief pause before resuming, just to be comfortable. Come slowly out of the pose, sending the hips straight back behind you, bending the straight leg and straightening the bent leg to reverse this and hit the hamstrings for a brief moment. I like to waggle the foot a little bit in this stretch. Okay, now come back to all fours and switch legs, sending the other leg forward, and make sure that you keep your knee stacked above the ankle. Keep a gentle pelvic tuck to protect the lower back. Tight thighs really aggravate lower back pain, pulling down and encouraging that sway back posture I mentioned where the booty sticks out, which creates compression and pain in the lumbar spine. Even though we're not working the lower back directly right now, by releasing the front of the leg, we're still providing tremendous relief to the lower back and improving the overall alignment and balance in our physical bodies. Okay, send the hips directly back to reverse that stretch and hit the hamstrings for a brief moment. Congratulations on completing this massage therapy-inspired practice for the lower body. Please hit subscribe below for more and more resources to incorporate into your regular routine to maintain good alignment, connective tissue health, and a pain-free body. Thank you.